Your doctor said Prozac would help your anxiety, but she didn't mention it might kill your sex drive. If you're a woman over 40, several changes occur in your brain and body during the menopause transition. There's a reason why perimenopause worsens sexual side effects from Prozac, but you also need to know about the one nutrient deficiency that amplifies it and what you can actually do about it without suffering in silence. Hi, I'm Dr. A. I'm an integrative psychiatrist and lifestyle physician. Let me tell you about Jessica. She's 47, started Prozac for anxiety 6 months ago. It helped her mood, but her libido, gone. She told me, I love my husband, but I feel nothing, like that part of me just shut off. She thought it was just menopause. It wasn't. If you're on Prozac or considering it and you're over 40, this video is for you. Let's be clear, Prozac works. It's one of the most prescribed SSRIs for anxiety and depression. It increases serotonin in your brain, which helps stabilize your mood. But here's what most doctors don't tell you. Sexual side effects happen in up to 70% of people taking SSRIs like Prozac. That includes low libido, difficulty with arousal, trouble reaching orgasm, and complete loss of sexual interest. And for women over 40, it could be more challenging for several reasons. Perimenopause is already messing with your hormones. Estrogen is dropping, testosterone, yes, women need it to, is declining. Your body is already struggling to maintain desire, lubrication, and pleasure. Then you add Prozac. For some people, it's like throwing a wet blanket over a fire that's already dying out. If this is resonating with you, subscribe to this channel so you don't miss future content on reclaiming your mental and physical wellness. Here's what's happening in your brain. Prozac increases serotonin. That's good for mood. But serotonin boosts signals that slow down sexual response, while it also reduces testosterone and dopamine activity. Both are crucial for healthy sexual function. Dopamine is your brain's pleasure and motivation chemical. It's what makes you want sex in the first place. When dopamine drops, so does desire. There's more. Prozac also affects nitric oxide, a molecule that helps with blood flow and arousal. Less nitric oxide means less physical response, even if you want to feel something. And in perimenopause, your estrogen is already low. Estrogen helps regulate serotonin receptors and support sexual function. So you're dealing with declining hormones, medication side effects, and a brain chemistry shift. No wonder you feel disconnected. Studies show that many women taking SSRIs like Prozac are at risk for zinc and vitamin B6 deficiency. This is because women with depression often have low dietary zinc intake, and this can make symptoms worse or lower antidepressant effectiveness. SSRIs may also change how the body uses or absorbs micronutrients. This means women taking Prozac can be more likely to have low zinc, especially if their diet is lacking or they have other risk factors. There is evidence that antidepressants like fluoxetine can interact with vitamin B6 metabolism. Vitamin B6 levels affect brain chemical production, which can alter mental health outcomes. Multiple studies have shown that zinc deficiency can reduce the effectiveness of SSRIs like Prozac. When zinc is low, SSRIs may not work as well to improve mood or relieve symptoms of depression and anxiety. If you're struggling with the sexual side effects of Prozac, you may be tempted to stop this medication on your own. But never stop an SSRI without talking to your doctor first. Abruptly stopping can cause withdrawal symptoms and mood crashes. Here are 5 things your doctor may recommend. Number 1, adjust your dose. Sometimes lowering the dose of Prozac helps with the sexual dysfunction. Number 2, add bupropion, also known as Wellbutrin. This is an antidepressant that works on dopamine and norepinephrine, not serotonin. Studies show it can counteract SSRI-related sexual side effects. Number 3, support your hormones. Consider bioidentical hormone therapy if you're a candidate. Estrogen and progesterone can restore some of your sexual drive. Number 4, lifestyle strategies. Exercise boosts dopamine naturally. Prioritize sleep. It regulates your hormones. Consider stress management. Eat protein-rich meals to support the production of brain chemicals. Number 5, optimize your nutrients. Get tested for zinc, vitamin B6, magnesium, and vitamin D. This support dopamine, hormone production, and overall brain health. To discover the top 5 nutrients I recommend for women over 40 and the types to consider, watch the next video.